This patient in the intensive care unit is going to require a central venous catheter. We're going to put in a right axillary line. We're going to use the Delta Nautilus EKG tip verification system. The patient it's a diaphoretic patient, so we're going to use Mastisol to help secure the dressing in place for up to 7 days. So we've prepped the patient with chlorhexidine, some LIDOCAINE. All right, we're going to puncture the axillary vein. Okay. Pass our Nitinol wire. Feels like it's going nice and smoothly. So the feel has been good. So I believe it's probably turned down. It's clearly in the vein. Next thing we're going to do is put in the 5 French Microintroducer, and we're not going to cut the skin because the skin is the barrier to infection. So again, it feels like it's going in properly. So next thing we're going to do is take out the inner cannula and the wire. And we're going to pass the J wire. At this point, we're going to remove the 5 French introducer. Dilate with the 7 French dilator. Again, we're not going to cut the skin. Okay, now she's dilated. And she's got high venous pressure. Okay, so we're going to put the wire in. We're going to reattach the alligator clip. We're going to be looking for our P-max here. We're seeing a very large P wave at about 18 centimeters. We're going to go into 19. We're going to go back into 19. And I like 19 the best. I don't know if you can. All right, now at this point we're going to open up some Mastisol so that our dressing will go on and stay securely.
Okay, yes, perfect.
Okay, so she's going to crack it. Now open the package, and I'll take it sterilely. Good. Good. Okay. All right, so we're going to put on our bio patch, and we're going to put on our stat lock, and we use the skin prep to help the stat lock stay down in place. Put one wing down, then the other. We'll pull that on. We're going to put on the Mastisol. So around where the dressing. We're going to let that dry. So the Mastisol dries fairly quickly in about 30 seconds. So I can see that the Mastisol, the tackifier, is starting to dry. And you can feel the way the Mastisol causes the dressing to adhere. It definitely has a different feeling. At this point in time, we have what I consider to be modern vascular access. We have an ultrasound guided right axillary vein, and the catheter now is on the chest where it belongs, so the nurse can provide proper care and maintenance. We use tip locating technology, demonstrating that we're in the right place near the cavo-atrial junction. We put on the dressing without sutures, and we used Mastisol in this diaphoretic patient to help the advanced dressing stay in place for up to 7 days.